Hello, today's presentation will be on experts who speak on veterans and active military, a presentation by Charlene B.A. An important area of veterans active military that we are going to focus on is post-traumatic stress disorder. Post-traumatic stress disorder is a trauma and stress-related disorder that may develop after exposure to an event or ordeal in which severe physical harm or violence occurred. Symptoms range from having bad dreams, re-experiencing the event, dissociative reactions, avoidance, and suicide. The topic is veterans and active duty members suffering from PTSD. The numbers show just why PTSD is important and why there needs to be continued research on the subject. The data presented is out of 100 service members from each war. 15% Vietnam veterans, 12% Gulf War veterans, and 11% Iraqi War veterans suffer from PTSD. Pai, Surrey, and North explain controversies surrounding PTSD range from the definition of a trauma to whether PTSD should be considered a condition at all. There are two key questions to consider when thinking about PTSD. The first is, what is the most likely amount of time a military member must be deployed in a hostile environment before they experience signs of PTSD? And the second is, what age range of service members are most at risk for developing symptoms of PTSD after experiencing a hostile environment? We have two experts that can help answer these questions. Dr. Roger K. Pittman and Dr. Jane K. McNaught. Dr. Pittman is a licensed psychiatrist out of the states of Massachusetts and New Hampshire. Dr. Pittman is a professor of psychiatry at Harvard Medical School and an internationally recognized researcher, teacher, and clinician focusing on post-traumatic stress disorder. He is board certified in psychiatry and forensic psychiatry. Dr. McNaught is a licensed psychologist of Minnesota, clinical and forensic psychologist. She has been in private practice for over 30 years and specializes in post-traumatic stress disorder within the context of civil, criminal, and family law. Each of them have contributed a great deal in researching PTSD. Dr. Pittman spent many hours researching the age range that service members are most at risk for developing symptoms of PTSD after experiencing a hostile environment. Dr. Pittman spent the last 5 years conducting and reviewing field studies to see the correlation of military members' behavior before and after they have experienced a hostile environment. The studies included men and women of all branches and ages ranging from 18 to 50. From this psychological research, Dr. Pittman concluded that the individuals who are most at risk of developing PTSD are those between the ages of 18 to 29. Dr. McNaught has spent countless hours studying the time frame that it takes for a military member to develop PTSD after being deployed in a hostile environment. Dr. McNaught took an archival research approach by conducting a meta-analysis of various studies on the topic. After reviewing several studies and comparing the results, Dr. McNaught concluded that high numbers of deployments and longer cumulative length of deployments are the greatest risk factors for military men and women to develop PTSD. Both doctors have their own views when it comes to PTSD, but they each have the same conclusion. Dr. Pittman states that PTSD affects people differently. Hostile environments can lead to PTSD, and ages 18 to 29 are most at risk of developing PTSD. Dr. McNaught also states that hostile environments contribute to PTSD. Higher numbers of deployments and longer deployments increase chances of PTSD. They both conclude that hostile environments can lead to PTSD. Thank you very much.